Well, it's February, and you know that February is American Heart Month. So we really need to say something about our hearts. And not only is it Valentine's Day, which it just was, so I want to say happy Valentine's Day to all our listeners out there. But we do want to talk a little bit about hypertension, a topic we've really never discussed on this show. So if you want to know more about hypertension, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. So yeah, it's American Heart Month, and just in line with that, we are very fortunate to have with us this morning Dr. David Anwar, a cardiologist. Good morning, doctor.
Good morning, Andrea. How are you?
I'm very good, and thanks for being with us on, we have to say something about hearts for American Heart Month. And I thought a topic that would be very relevant, because obviously it affects so many people, is hypertension.
Absolutely. Hypertension affects 30% of the Americans. It's a risk factors for many diseases, including heart disease, stroke, CKD, kidney disease, dementia. So yes, absolutely. It's a very important topic.
Just a few things. So first of all, can you define hypertension? What do we mean when we say that?
Hypertension, basically, it's elevated blood pressure. And we use a GNC7 guidelines to define it. So any blood pressure is more than 120, then it's elevated. Between 120 to 140 systolic, that's basically pre-hypertension. More than 140, this is when we start into the grades of hypertension. And there are two grades, from 140 to 150. It's grade 1. More than 150 is grade 2.
Well, it's interesting to me to hear you say that this is affecting 30% of the citizens of this country. That's an awful lot of people with this.
It is, yes.
And I'm guessing too, a lot of people have it and might not even know it because they don't have the awareness. What are some symptoms you might even look out for?
Yeah, so sometimes the symptoms are very mild, and sometimes they come. Most of the people that come to my clinic, they complain of headaches. That's the most common one from high blood pressure. Right. But a lot of times that really doesn't pick up the elevated blood pressure part. Usually when they come in, they're already at stage 1 or stage 2. Definitely headaches. Some people feel vision issues. Some people, even when they do the blood work, they found that the kidney numbers are elevated and they don't really know why. And then when you ask them, it turned out that they have high blood pressure for a while and they're not controlling it. Unfortunately, some people present as the first sign of a stroke or heart attack of their presentation.
Well, presumably, if you're going to see your doctor, any doctor, on a regular basis, your doctor is checking your blood pressure.
Correct.
And hopefully you and your doctor are discussing, what are my numbers? How am I doing? So Absolutely. Part of me, I like to think that as an adult going to the doctor, you would ask the doctor. Do enough people have a dialogue with you?
Yes, as a matter of fact, checking the blood pressure at a doctor's office is probably not a good idea. Yes.
White coat anxiety.
Absolutely. When people, like, for example, when people first meet me, they don't know me. They're like, what kind of character he is? Is he going to be nice? Right. So yeah, so checking the blood pressure in the doctor's office, probably not the best. And I see a lot of people come in, they have high anxiety level, they coming to see cardiologists. They're worried about their heart health. They're not really sure what I'm going to say to them, if we're going to need surgery. Sometimes they take it, very out of proportion. And I really barely manage blood pressure based on office readings. I always tell the patient, like if I got a patient and his blood pressure is elevated, I tell them, listen, calm down. I need to buy a blood pressure machine. Check it in the morning and at night. In the morning when you wake up and at night before going to sleep. Make a log for a week and then send it to me. And based on these numbers, we'll decide whether you need treatment or not.
Because then you're out of the office. I have white coat anxiety myself, so I totally get that. And I guess when you're checking it when you're home in your own environment, when you're nice and calm, you don't have a doctor or a technician staring you in the face, right? It's a little less intimidating.
Absolutely.
Well, that makes sense. That makes sense. So now that you've established for someone that their pressure is high or even a little bit elevated, at what point do you say to someone, you know what, you need to be on high blood pressure versus maybe there are some lifestyle changes that you could make to mitigate this?
Right. So great question. Usually, if somebody's blood pressure 140/90, that's when we say, hey, listen, lifestyle changes. If it's more than that, then it's probably a mix, lifestyle changes and a medication.
Okay.
140, it's considered still in the hypertension part. 140 to 160, stage 1, more than 160, stage 2. So it's always, we learn that, stage 1, most likely they're going to get controlled with one medicine. Stage 2, most likely they're going to get controlled with 2 or more medications.
So once you go on high blood pressure medication, and I feel like for some people, like it's a sign of defeat. Like, what have I done wrong? Now I have to take medication.
Yes,
But
yes.
can you change it? Can you change your lifestyle enough that you no longer have to take medication?
Right. Yes. So one of the main causes of why we have high blood pressure is that our arteries over time get stiff. And sometimes they get stiff because of atherosclerotic heart disease, like the plaque gets built up in the artery and make it a little bit stiff. So I always tell the patients, you don't want to take the medicine, that's fine. But number one, you need to lose a lot of weight. Number two, you need to eat healthy. Number three, you need to stop your salt, stop caffeine. If you're drinking so much coffee, you have to stop. And that's basically the main ones that I tell them. So a lot of people, young people specifically, their main issue is obesity. And I tell them, if you lose the weight, you're not going to need any medicine. And we see that true every day. A lot of people that come in, let's say they go for bariatric surgery, they come back without any medications, no medicine for blood pressure, no medicine for diabetes, nothing.
Right. All right. So, hope is not lost. You can make changes in your life
Absolutely.
that you can
Absolutely.
get off your medication, which is a good thing.
Sometimes also we check, like if somebody come in with elevated blood pressure, we check for sleep apnea, we check for other disease that no one would think what's the relationship, but they are related. For sleep apnea, thyroid disease, if elderly patient come in with high blood pressure, I check for coronary artery disease to make sure that his heart itself is not the reason why he's having high blood pressure.
So obviously there's a lot of reasons why you might have elevated blood pressure. And I mean, that alone, I'm sure makes people's blood pressure go up just knowing that their pressure is high. I mean, I know it's like a vicious cycle. But the point of it, as I'm listening to you, is there can be so many reasons that could be causing this, and you have to get to the bottom of it.
Correct.
And take care of it before it gets really into a much worse situation. So there are solutions. There are definitely solutions beyond medicine.
We definitely try to find the reason. 90% of blood pressure is essential hypertension, and essential hypertension, basically 90% of it is idiopathic, meaning we really don't know why it happens. But we try our best to, those diseases that I mentioned, we screen for to make sure if it's something like that, we can reverse it. Oh, and one more thing that I forgot to mention earlier, exercise is very, very important, because when you exercise, you're making your blood vessel more flexible, and therefore you decrease your blood pressure.
So once again, we always tell people, don't be a couch potato, get up and move.
Oh, absolutely. That's very, very important.
Yeah, it's not like you have to run a marathon. We always like to say at least 30 minutes of activity every day. Even just
Correct.
Walking, just get out there and move. There's benefits, well, not just to your heart, but to all of you. But we're really focusing on our hearts today. We only have one, and it's working pretty hard.
Absolutely.
So as a cardiologist, what do you have any other advice you just want to share? Obviously, I want to say to everyone listening out there, listen to your doctor, have your pressure checked, make sure you go to the doctor. but here we have an opportunity to hear directly from a cardiologist some good advice.
Yeah, absolutely. The good advice is that if you're still, not hypertensive, it's time to prevent it by exercising, as you mentioned, by eating healthy, very important, and by cutting down the salt as much as you can. These three really, I think it will go a long way for the patients. If you already have high blood pressure, then you need to basically be adherent to medications. Make sure you check your blood pressure in the morning before you take the medicine and at night before you go to sleep. So you have a good understanding and estimate of if your blood pressure is controlled or not. And of course, making sure that you see your doctor on a regular basis.
Last question I want to ask you, are there any, I'll call them natural remedies that you can suggest that actually can affect in a positive way to lower your pressure?
To be honest with you, I'm not really big on natural remedies just because I did not study it.
Okay, fair enough.
So, but if a patient comes to me and tell me, hey, listen, I read online that this would reduce blood pressure, I don't argue. I was a patient, tell them stop. I'm like, hey, listen, try your own. If you feel like this is good, this is part of the lifestyle changes. So I always tell the patient, that's fine if your blood pressure is in a range where you could do that. Like if it's maybe 145, yeah, sure, I could let him do that. But if
Oh,
it's
I
already
see.
160,
Okay.
170, I'm like, okay, you can do this, but you still need to take the medicine because I know for sure that the medicine works. The natural remedies, I'm not really sure. I do have some experience with cholesterol natural remedies, and my experience with them is hit or miss. I see it respond. Some people it would respond for them, and the other people, I tell them exactly what the other person does. They come back, absolutely no difference.
Right, so not everything works for everyone, but I'm
Correct.
also understanding now if your pressure is high enough that your doctor is concerned, you probably even short term be on medication because that could lead to a lot of other much more serious issues.
Absolutely, absolutely, yes.
If you miss a blood pressure pill on whatever day, do you take two? Do you just skip the day and take it again on the regular basis the next day?
Um, yeah, it's a great question. We get asked that a lot too. If you skip a blood pressure pill because you're out or you don't have it, then just take the next dose regularly. Do not double up on the dosage. That's the first thing. Now, if you let's say skip it in the morning and you go back home in a reasonable time, and then I tell the patient you can take it then. You can
Okay.
take it. Yes. And again, I always tell the patients, make sure you check your blood pressure in the morning before taking the medicine. For example, a lot of times, patient, let's say they feel sick in the stomach and they just had a big vomit or diarrhea and they're dehydrated. I tell them, listen, if your blood pressure less than 100, skip the dose, do not take it. Because if you're already in a dehydrated state and you take a blood pressure medicine, it's just going to make you feel awful. Yeah. So definitely check your blood pressure in the morning before the medicine and see.
Okay. All right. Good answers there. Thank you. Oh, Dr. Anwar, I really appreciate you being with us today. And I hope everyone out there learned a few things. But I think my biggest takeaway is that you want to head this off before it gets worse. And lifestyle changes with so many things can make a big difference, but
Absolutely.
especially for your high blood pressure. So
Absolutely.
improving your lifestyle will most likely improve your overall health. So let that be your first option, right?
Absolutely. That's correct.
Nobody ever aspires to go to the cardiologist, no offense, right? We don't,
Why?
we always want to say, we don't want to see you professionally if we don't have to.
Believe it
Yeah.
or not, I see a lot of patients for cholesterol and high blood pressure, not primarily for heart issues.
Oh, real? Okay. All right. Well, they
Yeah,
seem to go hand in hand, high blood pressure, high cholesterol.
they do. They do.
Very, very typical. But again, no substitute for seeing your doctor. You always want to make a point of seeing your doctor and making sure you have your blood pressure checked on a regular basis.
Correct.
Okay. Well, thank you so much, Dr. Anwar. We'll have all of the doctor's contact info for everyone in case you want to reach out to him. So remember, everyone, it's the month of February. It's American Heart Month. Be good to your heart. And if you're good to your heart is going to be very good to you. Remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Anwar.
See you later.